processes or the transport mechanisms, then you will be very careful. You will have a complete picture of transport processes in mind of the foundation module. You remember diffusion, simple diffusion and facilitated diffusion, transport in the active form, active transport, primary active transport or the secondary active transport, endocytosis, exocytosis, and pinocytosis or phagocytosis. So you will have everything in mind really, and you have to see what is happening and where is it happening, how is it happening. That's very important. Okay? So open your mind. You are now in the transport processes, and you will see what kind of transports are used for reabsorption. Okay? It's very easy. It's all concept that you are revising, which you learned before. Okay? All right. We are just doing the meanings of the reabsorption, and we are doing the significance of the reabsorption. Likewise, secretion is not a very big event which is happening in the tubules, but it is a very significant event. Okay? It is not comparable with the reabsorption. Obviously, reabsorption is much, much more, and the secretion is that much little. But even that little secretion is important for the body. Okay? Because with the help of secretion, you are achieving some goals. You are reaching some targets, hitting the targets. And these targets are that you are removing some substances which you cannot remove by filtration. Maybe by filtration some substances are not coming, so you are using the other side. Okay? You will go through the reticular capillaries into the interstitium, and from the side you will enter into the tubule, and then that substance can go into urine, isn't it? Many drugs also follow this behavior in pharmacology. You will learn that some drugs are not filtered, or they are filtered in a very little amount, but you have to excrete those drugs by the kidney. So the alternate route which can be taken by the drug is secretion. Okay? So you can use the phenomenon of secretion for the drugs. For some hormones, for some metabolites, you can use it. Besides, some normal mechanisms, homeostatic mechanisms to maintain things normally in the body are controlled by or are carried over by secretion. Two very important ions. Whenever I say secretion in the kidney, your mind will recall two very important ions, okay? Well, which are very, very significant regarding this secretion. One is potassium ions, secreted in a fairly good quantity from the tubules. The tubules are secreting potassium ions into urine, okay? Secreting into the fluid, and the fluid is going and turning into urine. It means some extra potassium which you have to get rid of is secreted specially into the tubules for the purpose of elimination, right? So you eliminate the potassium ions to keep the potassium balance in the body. Just not to exceed that quantity of potassium, you secrete potassium ions. So potassium metabolism or potassium homeostasis is very well controlled by the process of secretion. Okay? Second important ion is regarding the acid-base balance. And when I say acid-base balance, obviously the first thing comes in mind is hydrogen ion. Isn't it? The second thing comes is bicarbonate ion, definitely. But hydrogen is the foremost thing. Okay? Well, hydrogen ions are very intelligently secreted by the tubules just to keep the acid-base balance. If you remember, in the acid-base system, kidneys are the best buffers over the long-term basis.
Yeah, but they're the slowest.
Slow, steady, and for Tawil Mudda really, okay? They are the best controllers. They will take time, but their function is so impressive that they handle the acid-base balance very well, okay? So, in the acid-base balance, you have some chemical buffers, you have tanaffus which is operating, and finally you have the kidneys. The kidneys' role is coming in third line of defense, but still, this line is very powerful line, okay? So anyway, hydrogen ions are secreted in a very special way by the kidneys. So when I say secretion, you say, okay, secretion of metabolites and hormones, maybe drugs, but to regulate two very important things, one, acid-base balance, and second, potassium homeostasis. Please remember that, okay? So this is our target for the secretion. That's why this little part of secretion is very, very significant to the kidney. Okay? Alright. Now, using some terms, let's look at the diagram. Okay? Here you have the lumen of the tubule. It is the longitudinal section taken. Right? Here the cells, epithelial cells of one part of tubule are shown. Okay? These cells are attached to each other by the tight junctions. Can you see that? Yes. They are attached. Yet they have pores. They are attached tightly. But these tight junctions still have some space for the water and iron. Very surprising. Okay? So the tight junctions are adhering the cells or holding the cells. But at the same time, the tight junctions are meant for the transport also. Yani, through the tight junction, you can take the ions inside, and there could be a back leak also, like this. Okay? So it can go this way, or it can come from here. Right? This is the cell. This is another cell. This is yet another cell. They are adherent to each other by tight junctions. Can you see that?
Mm-hmm. Yes.
Alright. So, if you are having filtration here, the filtrate module here, this filtrate will take its way in this direction, right? Because at the back side you have the capillaries, the blood capillaries, peritubular capillaries and Basaretta module here. Good. And if you have the phenomenon of reabsorption, it means after filtration you are moving like this and you have to go and you have to reach the bloodstream really. So you have to cross certain barriers, you have to pass through certain areas, isn't it? You have to cross this area, and then you have to cross this area, and then you have to cross the capillary cell membrane, and finally you will enter into the bloodstream. Okay? Now, when the fluid or the ions or the substances are getting reabsorbed, they have two choices. Either they take the route through the cell, okay? And this is the surface area of the cell, infoldings of the cell membrane, just to increase the surface area. It's a brush border, right? And you know, brush border is for the absorptive process. So the more you have, the better will be absorption in that area, isn't it?
Right.
So either you have to go through this brush border, or you have a second choice to go through the tight junctions, as I said, isn't it? Okay. If you are going through the brush border, you are entering the cell directly. Are you entering the cell?
Yes.
If you are entering the cell, then you have to cross the back side of the cell also. And then you will enter interstitium and finally the blood. Okay? It means you are crossing the cell through and through. It's called the transcellular transport. What do you call it? Transcellular, because you have to pass through the cell. Okay? But if you don't want to go through the cell, you will choose another route, and that is tight junction. When you are passing through the openings of the tight junction, you are passing in between the cells. Can you see that? The side spaces of the cells, and that will be the paracellular on the sides. So two conceptual words are transcellular and the paracellular. I hope the meaning is clear. Great. It's easy. It's just a recall. We are revising few things. All right. Now, and water and ions can pass through the paracellular transport, and finally they can enter into the sheets of the capillary membrane in large amount. A bulk transport. Bulk means in a big amount, because if large amount of substances are module and they are traveling, and this capillary membrane is considered as a sheet, open sheet, then a large amount is going through a big surface area. This is called the bulk transport in bulk. It's not a little one. All the time it's happening and happening in large quantities. Okay?
So,
Yeah.
both will be in interstitium?
Yes. The meeting point is interstitium. Okay? At that point, there is a commonality, and from there they will go into the bloodstream. Okay? Alright. Now, these are the ways. Now look at the mechanisms of the transport very quickly. In few words, let's talk about the mechanisms which are used. Well, virtually all possible mechanisms are used in the kidney. Whatever we have learned in our basics, all mechanisms will apply here. You talk about osmosis word? Yes, osmosis is there. You talk about simple diffusion? Yes, it is. You talk about facilitated diffusion? You will see it here. You talk about primary active transport, very prominently seen here. You will talk about secondary, so many mechanisms of secondary available because you are reabsorbing so many substances.
Everything.
They have different behavior. So everything is a possibility here. Everything. Okay? Let's see. So it's a type of transport. So you will see the list of all mechanisms which we have known from before. It's nothing new. Primary, secondary, simple, facilitated, pinocytosis, and whatever. Okay? It's there. Alright? Well, few words about the primary active transport, which is a very, very important concept, and we know that. So we do not need to go into the details, just attach. One very important rule that we will follow and we'll see in the kidney. Let's go back to the diagram. Which side is the luminal side? Yeah. Which side is the luminal side of the epithelial cells? Right side or the left side? Right side is the luminal. And which side is the basal side of the cell? Left side. And which side is the lateral side of the cell? These are taken as the lateral sides. This is the basal side. So this is the basolateral surface of the cell. And this is the luminal surface of the cell, or the apical surface of the cell, you can say.
Alright.
The words are clear, they are giving you the meaning. So there is no problem. The primary active transport, the most famous primary active transport we talk of always is one, molecule in every cell of the body, without which the cell cannot live. And what is that active transport? Sodium, potassium, ATPase transport or the pump. It is the primary pump. It is essential, vital for the life of every cell. Okay? So are these. These are the cells. Okay? Now we have to decide where is sodium potassium pump module. Is it present here on this side, or should it be there on the back side? Or is it present everywhere? All surfaces, all sides. Well, clear it from the beginning. In the kidney, if you want to see the sodium potassium pumps, they are modules on the basolateral surface of the cells. Okay? Basolateral is making one surface actually, it's working as a single surface. Okay? So at the back side or at the lateral side of the cell, you will have sodium potassium pump module. Great number of potassium pumps, sodium potassium pumps are modules. Their number can change in different areas of the review, but always it's a good number module. And it is only present, I'm using the word only, present on the basolateral surface. It means it is not present on the luminal surface or the apical surface. Okay, this is the point you have to remember. You can use all other mechanisms, many mechanisms on the luminal surface, but you will not find the sodium potassium pump on the luminal side. Is that clear?
So,
Yeah.
sodium potassium pump is a primary pump?
It's a primary pump. Why primary? Because you can see ATP word here, direct energy consumption from the breakage of the ATP. Okay?
What about secondary active transport?
Yes. In the secondary, we'll see secondary, many types of
I
secondary.
think it
here.
also consumes ATP, but there's also exchange, right?
No.
No?
There is, see, the difference between the primary and the secondary active transport. Primary is utilizing the ATP directly because the primary transporter contains a built-in enzyme which breaks the ATP there and then and uses that energy and then it works.
Right.
Okay? That's called the direct working. Secondary active transport is dependent on the primary active transport which is modules nearby, because primary active transport is distributing the ions. Because of that ionic distribution, secondary active transport takes the advantage and it uses the energy of the distributed ion. And that energy of the ion is the driving force. It means it is using indirect form of energy, not the direct form of energy. And it is dependent on the primary pump. If primary pump is not working, your secondary system will also fail after some time. Okay? So secondary is active transport, but it is not directly consuming the energy. It is using the energy, stored energy, in some ions like sodium ions. Sodium ions are the best example,
Right.
because primary pump is distributing the sodium ions. Okay? And then these sodium ions become the driving force for the secondary active transports. Alright? So secondary is using the energy of the ion. It is not using the direct ATP energy. By saying active transport in both cases, primary and secondary, we mean one thing. The makhsus substance which you are transporting as active transport is going against the concentration gradient, and it is going uphill like this, from its lower concentration to its higher concentration. When you say active transport, always remember one word, that the substance that you are taking is going from low concentration to high concentration. In that case, you will call it the active transport. Second requirement, there are three requirements for the active transport. Remember the three rules for the active transport, whether primary or secondary. Upper, it is
Consumes
against the concentration
Okay.
that we talked about. Second, it uses energy directly or indirectly. It has to use energy because it is going against. Shabab? It's an uphill transport. If you have a ball and if you have a slope or a jabal, you are standing nearby jabal and it's like this, not very high, and you want to throw the ball up. Can you throw the ball without energy?
No.
No. You have to push it like this along the surface, then it will go. If you just leave the ball, it will not go up, isn't it? So, from the lower side to higher side, when you are moving the ball, what you are doing, you are using energy for that, okay? So, energy is the second requirement of the active transport, from the lower side to the higher side, right? The third is, you need to have a carrier or attachment site. If you don't attach that substance on the transporter, it cannot go. It cannot move without attaching. So three requirements you are fulfilling and you are getting the active transport. Number one, against. Number two, energy. Number three, carrier. If it is there, for primary active transport, yes, carrier, yes, against, and direct form of energy and ATP. For secondary active transport, yes, carrier, yes, against, and indirect form of stored energy in the ion. In both cases, you are using energy. The only difference is in the energy. Where are you getting it from? You are getting it from ATP or GDP, it's primary. If you are getting it in the form of ionic energy, stored energy in the ion gradient, it is known as the secondary. Okay? We'll see the example. And the examples are very conceptual and interesting. You will learn it, inshallah. Anyway, so now you know the basic mechanisms. So we learned one thing, sodium-potassium pump is essentially present on the basolateral surface. It's not present on the luminal surface. Okay? Now, secondary active transports, please. Okay? Because we are revising the transport processes very quickly. Secondary active transport requires the help of one ion, which is the driving force which is taking the other substance along with it. Okay? So, secondary active transport can be two substances going in the same direction, like this. Okay? Or it could be one substance going in this direction and other substance going in this direction. If the two substances are going, it is called co-transport, the symport. Okay? If one substance is going here and the other one is coming in the opposite, it is antipode or the counter transport. You know the terms. Okay? Now, in the secondary active transport, you can use the word symport and you can use the word counter transport or antipode. Both examples are much. No problem. We learn, inshallah. Going back to primary active transport, sodium-potassium pump. You see a pump in a protein. Sodium is going in one direction against the concentration, and potassium is going against the concentration into the cell. So, if you are saying, is it a co-transport or a counter-transport? So, it is also an example of a counter-transport. Yani, we are learning one more thing. It is not lazim that the co or counter-transport are modular in the secondary active transport only. It could be a primary active transport as well, as we are giving the example. Isn't it? So, you have to see only the mechanism, what is going. Is the substance going against the concentration gradient? If it is so, khalas, it's an active transport. Now, look, if this substance is using ATP directly, oh, it's the primary one. If it's not using ATP directly, it's the secondary transport. Alright? If I use one more way of classifying the transport substances, and you will help me, if I say one substance is attaching to a carrier, Wahid substance is attaching to a carrier, and that substance is moving inside or outside, anywhere, it's moving, okay? If one substance is attached, what will you call this transport as?
Unitransport?
Unitransport, make it as a little short form. Remove the word trans from that.
Uniport?
Yups. It will become uniport. Uniport means one substance is transported. Why is substance attaching and going? It's uniport. If I say two substances at the same time, okay, they are transporting or they are being transported inside or outside the cell, what will you call that phenomenon? According to this classification, dipole or bipole, you will say that. Okay? And if you say, no, I have seen three substances at the same time, 1, 2, 3, three mukhtalif substances attached to a carrier, and they are going, what will you call that? Yeah, it's triport, right? So uniport, biport, and triport. All right. This is also another way of classifying it. Okay. Now, I'll just ask you another question from your core knowledge from the back. If white substance is attached to a carrier and it is crossing the cell membrane from higher concentration, look at the word I am saying, please, from higher concentration to the lower concentration using the carrier. Yes, it is uniport.
Passive diffusion.
But give me the other name. Thank you very much.
It's a facilitated passive
I'm
diffusion.
saying facilitated diffusion. It's a carrier-mediated facilitated diffusion because I use one word in this Qanun of transport from high to low. So you will call it diffusion. Because you are using carrier, it's called facilitated diffusion. Sir, everybody is clear about that?
Yes.
We'll see the examples of facilitated also. Now, if I say one substance is attached to the carrier and it is going against the concentration here from low to high side, and this substance is also breaking the ATP and using the ATP, what will be the name of this transport then? You will say, oh, it's a uniport, but it's an example of primary active transport. Now, after this point, what do you have in mind? Is it possible to have in primary active transport a uniport mechanism or a biport mechanism? Both are possible?
Yes.
So, example of uniport mechanism, if I say, do you have any example of uniport mechanism in the body? Why ion or substance going against concentration, using energy, and doing the job? One. Calcium, right? Calcium pump. Wahid calcium pump. Only calcium. Hydrogen pump also.
Chloride pumps.
Hydrogen and calcium ions, they go in many areas of the body against the concentration with the help of direct energy and ATP. So this is an example of primary active transport. Alright? Okay. And if I say, no, I want a good example of a biport, which is primary active transport. So what example will you give? Sodium potassium pump. You have the best example modules here. It is there. Okay? So it's very easy. So now you have seen the ways we are talking about. We are using the terms uniport, biport, triport, and you are using the term antiport and symport. Whichever way we use the term, we understand the term and we can apply it. Are we all comfortable? We know the meaning of secondary and primary now, right? We are just okay. Look at some examples here. Now, that's very interesting. Look at the sides of the cell. Which side is the luminal side and which side is the basal side of the cell? You can see. This side is, and the back side is. Okay. Look at the pump also, which will give you the identification. Because sodium potassium pump is modules where? Back side. So this side should be the basal active side, isn't it? It is there. But look at the other side, opposite now. It's a new addition now. Look what is happening on the luminal surface or the apical surface. Okay? You can see some other mechanisms operating. Can you see that? Now let's try to work up and see what mechanisms are there. It's sodium, it's glucose attached to a carrier.
Right.
Okay? And they are going in the same direction. So try to give it different names, this mechanism. I want one good name for this mechanism. Biport?
Symport.
Symport or a co-transport. It's a biport, it's a co-transport
And
or
secondary actor.
and secondary. But Ahmed, if you're saying secondary, you have to give some evidence for that. Why are you
It's
saying
using ions, right?
Okay?
That's sodium right there.
All right. Who is the driver in this case? The main driving force in this sodium glucose co-transport. Who is the driver? Sodium. Who is the passenger? Who is being taken
Glucose.
inside? It's glucose. Yani, there is a difficulty in sodium movement or the glucose movement. What do you think?
Glucose.
Glucose. Glucose cannot go from the outer side to inner south without support. Okay? So it needs a lift or a support. And that lift is given by the sodium. Okay? So sodium is the driving force here. Why is the sodium driving force here? Let's look. This pump, secondary pump, is depending on the primary pump. Did I say that before?
Yes.
That secondary mechanism depends on the primary. Now we will prove it. Why?
Well,
This is pumping sodium outside, right? Here you have a high concentration of sodium already. It's outside the cell. Not naturally, normally we have high sodium concentration in ECF. Do you agree with me?
yes.
And we have a high potassium concentration in
ICF.
ICF or inside the cell.
Right.
Look at this pump. This pump is pumping sodium outside and potassium inside. Is it pumping against the concentration or along the concentration? Against. For sodium it is against. What about potassium? It is also against. It's a pure pump which is pumping in both directions against. So it's a very good example of the primary. It's a Kamil example of the primary active transport, isn't it? Okay, it fulfills every way. Okay. Now look at this pump. If it is pumping sodium outside, okay, then what is it doing? It is depleting the sodium or removing the sodium from inside. If you are removing sodium from inside, what will happen to the sodium level inside? Decrease. Outside in the filtrate, kathir amount of sodium is coming. Now you have created a concentration difference on two sides because of this pump. If this pump, I block this pump, what will happen? What will happen to the sodium concentration inside the cell? Increase. If it increases high inside the cell, do you think sodium from here can get inside here easily? No. So if sodium cannot get inside, glucose also cannot. Your pump is failed, isn't it? This proves that the secondary pump depends on the primary pump, and that energy for sodium ion is actually coming from the working of the primary pump. If it doesn't work, then the secondary cannot do anything. Okay? So, here, now from another concept, look at the diagram. I just want to clear the concepts. Look at this one. Glucose is going from high concentration to low or low to high? What do you say?
High to low.
It's outside in the filtrate and in the cell.
There is none in this. Low.
Decide one and give me the answer. Low to high? Are you agreeing on low to high?
Yeah, well.
You're saying high to low.
No, it's low to high. If it's an active
Let's take it one by one. Let's take it one by one. Okay? If you're saying it's high to low, okay? We generally believe that outside glucose is more and inside you don't see glucose in the cells, it's low usually in the body. Okay, but let's see. If this is high here and low here, do you really need glucose to be carried by this mechanism? No, in that case. Okay? If you are saying this is secondary active transport, right? And you have to prove that. If the glucose is going from high to low and sodium is also going from high to low, is it fulfilling the requirement of the secondary active transport?
No.
It is not. So it means it is not there. Okay? Now look at the other way. Glucose from low to high, okay? And sodium from high to low. Alright? Which of these two substances you will claim is transported actively, glucose or sodium?
Glucose.
Glucose only, not the two substances,
Yeah.
only glucose. Sodium is the helper only.
Right.
Look at the sodium only now. Look at the sodium and give me the answer. What is sodium doing? What is the behavior of sodium? What kind of transport will you classify as? It's a facilitated diffusion. And this pump is showing you two different phenomena at the same time. The active transport, secondary active transport of the glucose, and from the other side, from the other view, you will see, oh, sodium, it is attaching and it is going from high to low. So this is facilitates diffusion of the sodium. Okay? According to the rules that we have learned. Is it clear?
Right.
Okay. So this is a secondary transport. Okay?
Okay.
It is not necessary that in a secondary active transport pump or a process, both substances should be actively transported. If one substance is actively transported, you will call it secondary active transport. So is it right to call it secondary active transport?
All right.
Okay. What about this one? Sodium amino acid co-transport.
Same thing.
It's the same thing. Just the same. Remove glucose and put amino acid here. Okay. So you saw that. What do you mean by secondary active transport? Right?
Right.
Okay. That's easy. All right. Passive reabsorption. Okay. Passive means from high to low without using any carrier, because the difference of concentration is there. Okay. One thing is a difference of concentration will make it diffusion, isn't it? Second thing is the difference in the electrical charges. If on one side you have more negative charges and other side you have the positive charges, what can happen? Can positive move to the negative side here?
Most probably.
Yes, there will be an attraction. If you have a very high negative charges here and you want to bring further negative charges, is it easy to bring those negative charges?
No,
It will be difficult really, isn't it? So one thing is the concentration of the ions, the chemical nature of the ion. Second thing is the charge of the ion also. So charge can attract or charge can repel. Second thing, okay? So this phenomenon is called electrochemical gradient. When you combine the two terms, electro means the charge and chemical means the concentration of the ion. So this is electrochemical gradient which is operating. So in many cases, because ions are transported, you look it as electrochemical gradient, this term. Osmosis, the term, we are just repeating. Remember osmosis?
Yes.
For water?
Right.
For solutes?
No.
For other liquids? Oils or some other fluids?
No.
Was only for water?
No.
If you have any example, Ahmed?
I think pure water can work. You need to have some salt in it, which makes it a solute.
Okay, but when you focus osmosis, do you think you are carrying water only or you are carrying water along with the
You're
soil?
moving water on.
You are moving water only. What you are saying is that along with the water movement, when a large amount of water is moving from one side to the other side, there is dragging of some solute ions. But that process, that's a very interesting term that came from Ahmed's discussion or answer. Osmosis is only for water. Okay? But along with osmosis, when it's happening in the large areas of the body or large sheets of the body or absorptive areas, then water is going and solutes are modules in the water. So they are also carrying, like you have river flowing here and you have some leaves or other things which are there in the river. Well, the leaves are flowing along with the movement of the water. Okay, so it means the water is dragging those substances or carrying those substances. The same thing can happen in the body also. Some ions are dragged by the osmosis of water, and this drag is called the solvent drag, because water is the solvent, and that dragging force or taking of those ions along is called solvent drag. So solvent drag is another thing, but when you say osmosis, this is mahsus or water. We keep it for water, right? Osmosis is a form of diffusion. Do you agree with me or you don't agree with me? I say osmosis is diffusion. It's the diffusion of water. Do you say yes? Yes, it is. Okay, because it does not require any carrier. It's going from higher concentration of the water to the lower concentration. So osmosis is a special name of water diffusion, Mustax. Okay, osmosis is nothing else. Osmosis may be classified separately, but actually it's a part of simple diffusion. Osmosis is simple diffusion, please. Alright? It's okay. Now we'll see the processes. It's not. And you know, yes, Ali.
Previous slide.
Previous slide? Okay. This one, Ali? Back? This one?
From left to right.
Okay. Alright. That's a good point. Okay. Let's take it another way. We are saying we know diffusion follows the Raman from everybody knows. Here you are saying that osmosis is occurring from high concentration of water to the low concentration side of the water. It's okay, we will all believe that. But what is here? It's written in a different way. From lower osmolality to higher osmolality. Now look at this one. See, you have water on two sides. Alright? On one side, you have water with a very little salt molecule in it. Very little salt molecule. And it's taqriban pure water with a very little few molecules of, or a few ions of NaCl or sugar molecule. Okay? On the other side, you have water, and here you have a large amount of salt module here in this one. Okay, so it's a high salt solution on one side and a very low salt solution on the other side. Now, Ali, think on which side you have a higher concentration of the water, higher on the low salt side. You have more pure water module here, isn't it? So now you consider your definition. Water will move from its higher concentration side to low concentration side. So water will move from low salt solution to high salt solution, or high salt solution to low salt solution. From low salt solution to high salt solution. Now look at this diagram. Low osmolality means low salt solution, and high osmolality means high salt solution. Did you get that?
Yeah,
so this is yet another way of holding the nose from here like this, okay? Instead of holding the nose like this.
Right.
This is the only way. From the higher concentration of water to the lower concentration of water, or from the lower solute concentration side to the higher solute concentration side. It is just the same thing. Alright? So it's good that you recalled and we discussed this point. There are two ways of defining osmosis. From the point of view of water and from the point of view of solute salts. Is that clear?
Yes.
I think we know pinocytosis, small membrane invagination, and you are taking some amount of water inside the cell
As
membrane.
opposed to
Makes
endocytosis.
a little vacuole or a bubble or a vesicle, and that basically goes inside and it attaches. This is called pinocytosis. Pinocytosis is a smaller version of endocytosis.
Yeah.
Because you are going inside the cell.
Right.
And if you have a larger version, taking a big particle or a bacterium, then it's a phagocytosis. Okay? Where cell is eating that substance, so engulfing that substance. Isn't it? Okay. There is no break, I'm sorry. But sorry for not removing the slide. Anyway,